Welcome to UMCC Medical Consultants Connector, where your health matters to us. Tuberculosis, often just called TB, is a serious infection. It usually attacks the lungs, but can impact other organs too. Military tuberculosis spreads quickly among people in close quarters, like military barracks. It spreads through the air, similar to the common cold. Tiny droplets containing the bacteria are released when a person with active TB coughs, sneezes, or talks. While TB is treatable, it can be serious if left unchecked. Some people carry the bacteria without symptoms, called latent TB. Understanding military TB is vital for protecting our troops. Military tuberculosis is caused by a bacterium called Mycobacterium tuberculosis. This bacterium thrives in crowded environments with poor ventilation, making military barracks and other shared living spaces susceptible to outbreaks. Close contact among military personnel during training exercises, deployments, and daily routines facilitates the airborne transmission of the bacteria. When an infected individual coughs, sneezes, or speaks, tiny droplets containing the bacteria are expelled into the air. These droplets can remain suspended in the air for hours, increasing the risk of infection for others sharing the same airspace. Factors like stress, fatigue, and limited access to healthcare can also weaken the immune system of military personnel, making them more vulnerable to TB infection. Addressing these risk factors is crucial for preventing the spread of military tuberculosis. Implementing proper ventilation systems in barracks, promoting respiratory hygiene, and ensuring timely diagnosis and treatment are essential steps in mitigating the impact of this disease. Recognizing the symptoms of military tuberculosis is crucial for early diagnosis and treatment. While some individuals may not experience any symptoms initially, others may develop a range of signs that warrant immediate medical attention. One of the most common symptoms is a persistent cough that lasts for more than 3 weeks. This cough may produce mucus and, in some cases, blood. Other common symptoms include fever, chills, night sweats, unexplained weight loss, fatigue, and loss of appetite. Chest pain, shortness of breath, and wheezing may also occur as the infection progresses. It's important to note that these symptoms can also be indicative of other respiratory illnesses, so it's essential to consult a healthcare professional for an accurate diagnosis. If you or someone you know in the military is experiencing any of these symptoms, it's crucial to seek medical attention promptly. Early detection and treatment are essential for preventing the spread of TB and ensuring a positive outcome. Section 4. Diagnosis and detection. Diagnosing military tuberculosis involves reviewing medical history, physical examination, and lab tests. The provider asks about symptoms, medical history, and TB exposure. A physical exam checks for signs like swollen lymph nodes or abnormal lung sounds. The primary test is the tuberculin skin test, or MAN2 test. It involves injecting tuberculin under the forearm skin. The site is checked after 48 to 72 hours for induration. A positive test indicates TB exposure. Further tests confirm infection. These include chest X-rays, sputum cultures, and blood tests. Early diagnosis and treatment prevent TB spread and ensure positive outcomes. Section 5. Treatment and prevention. Treating military tuberculosis involves antibiotics taken over 6 to 9 months. Completing the entire course is crucial to eradicate the bacteria. Incomplete treatment can lead to drug resistance. Supportive care, like rest, a nutritious diet, and fluids, promote recovery. Preventing TB spread requires a multifaceted approach. Effective infection control measures and education on TB transmission are paramount. BCG vaccination is recommended for high-risk military personnel. Early detection through screening and contact tracing is crucial. UMCC, your ultimate medical consultant connectors.